Welcome to The Explainer. Today we are digging into something that honestly probably keeps a lot of us up at night. Why in the world is American healthcare so expensive? And maybe more importantly, is there a way to fix it? We're going to break down one potential path forward.
All right, let's just start with a number. A big one. $14,570. Think about that for a second. That's the average cost of healthcare for just one person in the U.S. back in 2023. I mean, for a lot of families, that's like buying a new car every single year. It's just staggering.
And that personal cost, that's really just the beginning. When you zoom out and look at the whole country, we're spending about 18% of our entire economy on healthcare. Just look at this chart. We're spending nearly double what other high-income countries spend. It's like if you spent almost a fifth of your paycheck on just one single thing. That's what we're doing as a country.
Now, for this entire breakdown, we're drawing from some really fantastic, in-depth reporting from our friends over at Shasta Unfiltered. Seriously, they're the ones who did the heavy lifting here, combing through all the data to give us a clear way to understand this mess. You should definitely check out their original piece if you want to go even deeper.
Okay, so here's our game plan for today. First, we're going to look at the sheer size of this $4.9 trillion problem. Then we'll get into the tangled mess of why it costs so much. We'll also tackle the doctor shortage, which is a huge piece of this. And then we'll talk about a potential cure, something called universal HSAs, and finally, how we could actually make it happen.
All right, first up, America's $4.9 trillion problem. Let's really wrap our heads around how much we're spending and what we are, and maybe more importantly, what we aren't getting for all that money.
Okay, and here is the absolute craziest part. We spend more than anyone else on the planet by a long shot, but we're not healthier for it. Not even close. Our life expectancy is lower, and our infant mortality rate is higher than in many other wealthy nations. So it begs the question, right? If the money isn't making us healthier, where on earth is it all going?
So yeah, where does all that money go? Let's peel back the layers here and really look at what's driving these insane costs.
Well, a huge piece of the pie gets eaten up by, let's be honest, bureaucracy. Just look at this. A quarter or even more of every single dollar we spend on healthcare doesn't go to doctors or medicine. No, it goes to administrative costs. We're talking paperwork, billing, coding, just navigating the maze of insurance rules.
That adds up to, get this, up to $1.2 trillion a year. That's not money for patient care, it's just money to keep the complex, fragmented paperwork machine running. It's just mind-boggling.
And because our system is so fractured, it leads to this really weird situation with pricing. I mean, think about it like this. You go out to eat, and the person at the table next to you orders the exact same thing, but they only pay a third of your bill. You'd be furious, right? Well, that's basically what happens in healthcare. Hospitals and doctors charge people with private insurance way more. We're talking 2 to 3 times more, just to make up for the lower rates they get from Medicare.
And it doesn't stop there. The costs just keep piling up. We've got massive amounts of fraud, waste, and abuse, to the tune of hundreds of billions a year. Then you have the super high price tags on new drugs and technology. Plus there's all the care for uninsured folks that hospitals have to absorb, and, you guessed it, pass those costs on to everyone else. Oh, and our system actually encourages overuse of services we might not even need.
Okay, so as if all of that wasn't enough, there's another huge problem looming. We don't have enough doctors. And, basic economics tells you what happens next. When demand is high and supply is low, prices go up.
And we're not talking about a small gap. The projection is a shortage of 86,000 physicians by 2036. That's a huge number. And it's not some abstract problem for the future. This directly impacts our ability to get care, especially as the population gets older and more doctors start to retire. The problem's just getting bigger.
So why is this happening? Well, a huge part of it comes down to money. There's a pretty big pay gap between being a primary care doctor and being a specialist. I mean, put yourself in their shoes. You've just finished med school, you have a mountain of student debt. Are you going to pick the lower paying job? For a lot of new doctors, it's really a no-brainer to go for the specialty.
And this quote from the source material really just hits you. It says primary care doctors have become the modern equivalent of early 1900s garment industry piece workers. Wow. I mean, that really paints a picture, doesn't it? It captures that feeling of being on a treadmill, forced to see a crazy number of patients for very little reimbursement. It's a recipe for burnout.
Okay, so we've spent a lot of time on the problems, and they are big. But what about a solution? Is there another way? Well, the article we're looking at proposes a pretty bold idea to remake the whole system centered around something called universal health savings accounts. So what are these? The core idea here is actually pretty simple. It's about putting you, the patient, back in the driver's seat. Everyone would get a tax-advantaged account, helped out with government subsidies, to pay for their own routine care. When you're spending your own money, you start asking questions. How much does this cost? Are there cheaper options? It forces providers to be transparent about prices and actually compete for your business.
And this proposal isn't just one little tweak. It's a whole system built on 6 key pillars. It's designed to tackle all the problems we just talked about. So let's run through them real quick. Number 1, fund these universal HSAs with a payroll tax. 2, have a Medicare backstop for the really big catastrophic stuff. 3, put in some strict cost controls and antitrust rules. 4, use the data from these accounts to sniff out fraud. 5, and this is clever, use those fraud savings to pay off doctor loans. And 6, expand access to things like outpatient care and telemedicine.
Now, let's talk about that fraud and waste piece for a second. The plan is to go after it hard. The estimate? We could recapture somewhere between $20 and $90 billion every single year. I mean, $90 billion, that's a staggering amount of money. And here's where it gets really smart. This plan creates this perfect loop. You take all that money you save by fighting fraud and you pump it directly into solving another huge problem, the doctor shortage. You use it to forgive student loans for new doctors, but only if they agree to work in areas that desperately need them. You're fixing 2 problems with 1 move. So, this all sounds pretty logical, right? But a plan on paper is one thing. How in the world could you actually pull off a change this massive? It's a huge undertaking with some pretty big hurdles.
Well, the proposal doesn't suggest flipping a switch overnight. That would be chaos. Instead, it lays out a gradual 5-year rollout. You'd start with some state-level pilot programs for a couple of years to test everything out, see what works, and collect data. Then, based on that evidence, you'd expand it, and only then would you start a full national implementation.
But let's be real. The biggest challenge here isn't figuring out the logistics, it's politics. A model like this would completely shake up the health insurance industry, and that industry has, well, a lot of power and a lot of money invested in keeping this system exactly the way it is now. And that really brings us to the final question, doesn't it? The source material lays out a detailed potential solution. The ideas are there. So the real question isn't, can we fix it? It's, do we want to? Will people actually demand this kind of change? That's the real unknown.